Hello everyone, welcome back to my show. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. And I've got another fabulous guest today. Her name is Dr. Katherine Ahn. She's a cosmetic dentist. And we have so much that has progressed in the field of anti-aging and regenerative medicine in terms of dentistry. I'm just shocked to see how much you can do and transform people just based on the jawline and just working with the teeth and the structure and the mechanics of the lower jaw and the lower face. Dr. Ahn, you've been a cosmetic dentist for almost like 22, 23 years. It's a long time. You do not look like you've been a dentist for 22 years. You look like you just graduated, but I have to tell everyone you're the most experienced dentist. So obviously anti-aging is working amazing for you. Tell me in terms of what is this thing about, how do you change like the structure, and what are all the tools that you use now, and the techniques and the technology to help people rejuvenate at that age?
Sure. I mean, in dentistry, of course, there is the traditional way of maintaining youthfulness by taking care of your teeth, making sure you don't have infection, and you make sure you're not losing your teeth, because if you lose your teeth, your face will sink.
Right.
And you will look older, obviously. And not taking care of your teeth, grinding and clenching, all of those things will shorten your face, and it will make you lose volume in your cheek area. So what I like to focus on actually is to help redevelop. Sometimes people have a perfect jaw position already, but then they lose it with age, and we can help them restore that. But then there are majority of the people who actually never had proper jaw development because they weren't breastfed or they were bottle feeding.
So breastfeeding has a lot to do with it, is that right?
A lot.
My goodness.
It's a huge factor in proper oral facial development.
Wow.
And so there are all these modern soft diet, all of those things contribute to improper jaw development.
When you say improper jaw development, what do you generally see outwardly?
Sure.
What do we generally see?
You generally see an upper jaw that's very narrow. It's narrow, usually crowded, and then traditionally a lot of dentists or orthodontists will take teeth out because they say, oh, there's too many teeth.
I know that's what they did when I was like a long time ago. And you're really not supposed to be taking the teeth out, right?
Very few. I mean, there are times when you have to.
But generally you try to avoid it now, right?
You can avoid it, especially if you can catch it early enough. When you're about 7 or 8, that's the best time to catch it and to help your body properly develop.
Right.
So now, instead of taking teeth out, what we want to do is actually help develop that upper jaw and bring the lower jaw into proper position so that the teeth can align and help support the cheeks and the lips so that you will look youthful. And you will have proper jaw function. And
what can you do? What are some of the things that you can help people put without, like, do they have to have like braces all the time, or are there the appliances that you can use that are not really noticeable? What kind of things they can do to minimize the, so to speak, the appearance, that they're not doing anything?
Okay. Well, I mean, if you're a young child, there are many different options.
Right.
But as you get older, it's a little bit more limited on what you can do. But there actually are new appliances, or what we call like alpha appliances, DNA or Homeoblock. There are various appliances developed by different dentists and orthodontists that can actually help adults develop their upper jaw as well. The lower jaw. And traditionally, there are still many dentists and orthodontists.
What are expanders?
Expanders are basically the appliances that I'm talking about. They're made out of special wires that have memory and that are very lightweight. And they can actually help stimulate movement of the teeth in the jaw.
So the expanders, are they devices that you can take on and off, or do they go outside and inside the teeth? Tell me a little bit about that.
Sure.
I'm really interested in that.
Sure. Most of them can be all hidden on the inside. But
Okay.
occasionally you may see a little bit of wire
Yeah.
on the side as you smile, but most of them can be hidden on the inside, and we can choose depending on what the patient needs.
Yeah.
You know, I will select for the patient whether they can have the kind that can be removable if they're compliant, or
So they can be removable as well. Wow,
yes.
fabulous.
but if sometimes they
Yeah,
need
yeah.
to have it fixed because they don't have the discipline to wear it.
Yeah, so it has to,
it
basically,
really
again,
depends on
person
the patient,
profiling,
yes.
absolutely.
Yeah.
So, okay, so that's one thing. Well, let's talk about, like, there's so much now in terms of whitening, and this is one of the things which I'm really concerned about from my own perspective, because, you know, I talk a lot about environmental toxins, I talk about a lot about, you know, keeping people healthy. There's been a controversy about, when teeth whitening, about that you're stripping the enamel, so actually you're doing more damage to the teeth because you don't, the enamel is, of course, the protective layer which helps the teeth from, you know, gum disease and from decay. Tell me a little bit about the whitening, the different kinds. We used to have just bleach, right? And then there was hydrogen peroxide. Now I hear that there is sodium bicarbonate. There's all sorts of things. Can you educate the consumer about the different kinds of bleaching? And I know you've got a fabulous product. I want to hear more about it. But if you could just give us a little information on that.
Sure. Yes, you're right. There are many different products out in the market. There are direct-to-consumer products like the Crest White Strip. But most of the whitening is done professionally in dentist offices, like professional, like Zoom or Ultradent Boost. Those are some of the popular ones that are out there.
And then there's lasers ones. There's also laser, right?
There's lasers, there's light activated ones, there's many different types. But basically most of them, it comes down to hydrogen peroxide or carbamide peroxide. Those are the two most widely used whitening agents.
For if you have sensitive skin and sensitive teeth, which I'm seeing a lot of my clients, they both have that of sensitive skin, but also sensitive teeth. So what do you, can you use hydrogen peroxide or do you use a carbamide peroxide? Which is more, I guess, that you would be more prone to use for sensitive teeth?
Well, if you have sensitive teeth, you can use a very low level hydrogen peroxide or a moderate level carbamide peroxide. So they work differently though. Carbamide peroxide releases a little slower the active ingredient.
Okay.
So a lot of people with sensitive teeth will, most dentists will recommend carbamide peroxide.
I see.
But you know, you can control the level and intensity even with
So again, it's a
peroxide.
personalized approach.
Yes.
And if you're as you are, you're just so apt with everything, so you can just personalize it and fit it for the patient. I see. And tell us about this product. I mean, this is like amazing. It's the I love it because I have sensitive teeth, so I was always searching for a product, and this is like pretty amazing. It's like it's still like you can put it on like a syringe. It's like you can do. Is it a
yes.
It's like a syringe, right? And so how do you do this? You just like put it on your teeth?
Well, you can do it a couple of different ways. If a dentist makes for you a customized bleaching tray, you can use this, put it under the bleaching tray,
and then put the appliance on, right?
Yes.
Or you can apply with a brush, right?
Yes.
Very
we developed
nice.
this so that we can apply with the brush, and we have a mouth guard that we use to protect the lips from the solution.
And what is the solution made out of?
I have two different kinds as well. The carbamide peroxide solution called Carbacor, and we also have Hydrocor, which is a hydrogen peroxide solution.
Okay, very nice. And then this is another product, Encore. It's a cleansing gel. Encore is your line of products, isn't it? I love the name. How did you think of the name? How did it come to you?
Well, I've thought of many different names, and anything good was already taken.
As usual.
Because there's so many products out there. But then I thought of Encore because one of the things that I hated about offering whitening to my patients was they will do it one time, and then it was so sensitive and so painful that they don't want to come back and do it again.
Honestly, I've been there. I did. It was so painful, and even when I went home with I was not compliant. I couldn't do it. Every time I would within 10 minutes, I would just get that tingling or pain. I just took it off. Yeah.
So when I discovered this product, it actually was originally being sold in Japan, and we are redeveloping the product, and now we have a proprietary ingredient that we're using. But I was very impressed when I tested this product out, because when I did a side-by-side test with the most popular brands that are out in the market right now, the sensitivity level was just so much better. And reduce.
And this is a cleansing gel. Tell me about cleansing gel. What is that?
What's unique about our
Yes.
Encore product line is that we have a system to help remove or lift the surface stain, as well as after the whitening is done, they can maintain the whiteness with a protective spray.
So is this a cleansing gel comes after before you use the
yes, before.
So you start to cleanse with it, you prepare it, and then you're ready to utilize this product. And then this is the protective spray, right? And you just I'm gonna try it. It's like what you just spray it on your teeth.
Yes.
So let me see. So oh yeah.
It's minty.
It tastes,
What's really neat about this is you can keep it in your purse, you can take it with you, and you can spray it on.
It tastes fine.
For coffee, tea, or red wine, and you can protect your teeth from that.
Wow, so it kind of coats it before that.
Yes, exactly.
So this is cool. I love it, and the taste was amazing. Because I didn't, a lot of times the taste of like a lot.
I think it's a pleasant taste.
A lot of time the dental products don't really have a great taste,
Yes.
but this is really a nice taste to it.
Thank you.
No, I think this is I am really looking forward. You know, I know that you've been in for almost 13 or 14 years in Huntington Beach. You've had a practice there, and I welcome you to Beverly Hills because over the last year you just sort of you're not even done your open house yet. And we're just very new, and just welcoming you to Beverly Hills, look forward to actually, referring my patients who need the dental whitening and all of the dental work and the anti-aging and regenerative work, because you're amazing.
Thank
I know.
you.
I've been around. I've been all over the world, so I keep up on a lot of things, and I love the reason I like what you do is because, again, it goes very much with my philosophy. You look to see what's good for that patient. You're personalizing their dental care.
Yes.
And it's not just it's not just like, okay, go get your teeth done, go get this done, or get your teeth cleaned.
Yes.
And it's just not like a machine. You actually personalize, you individualize. You're like very conscious of even you have both even the cleaning things. As I was noticing, if some people who absolutely want the fluoride in their cleaning. They get it, but some people are very against fluoride, and you have those options. You offer options for everybody, and I think that is very, very good. You're not just stuck in one viewpoint. You see what the patient wants, you see what you recommend, and then you arrive at a treatment plan, which is so important that both the client and you are involved in.
Yes. I'm very committed to educating myself, so I'm offering the very best.
Well, you're very educated. You're very educated.
I also want the patients to be educated and make informed decisions, and that's very important to me.
Well, thank you so much for coming on my show.
You're welcome.
I'm going to have you come on next because we're going to talk next about just gum disease and how it has important and how it can be related to internal imbalances. I can hardly wait to have you on. And I just welcome you again. Thank you so much, and for being on the show. And please, what is the website that they can go to?
The website for my product is encorewhite.com.
Encorewhite.com. And what is for your practice?
For my practice, it's impressiondentalcare.com.
Impressiondentalcare.com. Love it. I
or
love it.
imagecenter.info.
You have a fabulous. So very nice. Again, thank you, everyone. This is my show. Concludes it. NainaMD, Fusion of Science and Beauty. And we'll see you next week.